Hi folks, Dr. Jeff here from Ear Care Specialists. Now if you like impacted skin debris, then you're going to love this particular video. Just bear with me, the first part of the viewing angle is a little bit off there. When I look down the microscope I can see in the ear, but sometimes its alignment to the screen is slightly off, so I do have to check it once in a while. It gets better though, so please stay tuned. You'll see there's so much skin debris in this ear, probably within the top 5% of patients that I've ever seen for skin debris removal. And the patient had originally been to their GP no less than 3 times for ear irrigation. Now just looking in the ear, irrigation is really not appropriate, blindly pumping water into the ear. I'm not a fan, as you know, but in this case it's not going to budge this. This is just impacted skin upon impacted skin. I lose count of the amount of actual debris that I take out, but it must be 8 or 9. Anyway, 3 attempts at ear irrigation, nothing happening. They then came to see me for microsuction. Microsuction under a microscope where you can see exactly what you're doing when you're doing it is a far better approach to take. So we just carefully take out these skin reels one at a time until we can see the eardrum. Now the patient had used quite a lot of drops in their ear, which was useful because these skin debris are a bit softer, so we were able to just take them out quite easily. It took a little bit of time, but they did come out and they were wanting to come out, so it wasn't a tug of war match on this one. You see that we just keep going and keep taking more and more bits out of their ear. Now in this instance sometimes those debris can turn into infection. Luckily in this case there wasn't any sign of infection, just lots and lots of skin in the ear, so we're just removing the next layer here. Be good if someone counts the amount. I'm pretty sure it's 8 or 9. That was a big one, but we'll keep going. Now this patient did report that the last time they had any microsuction done was in 2017, so a good 6 years of build-up here, which is quite a lot. Most people don't build up skin debris to this extent. As I say, it's fairly rare, more commonly seen in a wax removal clinic, but fairly rare on the whole. One thing's for sure, their hearing was definitely affected, and once all this did eventually come out, their perception of sound was quite incredible, so everything sounded very loud to them by contrast. It usually takes 24 hours or so for the brain to reacclimatise. You see there, glimpse of the eardrum. Doesn't look too pretty with having all that skin trapped up against it for a while, but much better nonetheless. Thanks for watching.